The penicillin drama isn't the only worry for the state's hospitals. Today, there were revelations that some cancer patients had died while waiting for follow-up medical advice. The health minister's asked all hospitals to check for any backlog, but Jillian Skinner's focus is Westmead Hospital, where hundreds of patients have waited up to 3 years for letters to be sent to their GPs. State political reporter Bridget Glanville.
One of the state's largest hospitals is in trouble.
At the moment, you'd have to say that Westmead was struggling compared to its peer hospitals.
Last week, the hospital had its water supply cut off. Then it emerged that a patient who died had been given the wrong identification tag. Today, it's been revealed cancer patients have been kept waiting years to receive follow-up letters.
I mean, I think it's just incredible that this can be done without any type of acknowledgement that this was a potential problem.
This letter to a patient's GP was dictated in August 2009, but not sent until 2 years later. In that time, the patient died.
Communication between public hospitals and the family doctor is absolutely vitally important. The family doctor is absolutely crucial to people's care, getting them through the health system.
And that's not the only incident. Around 700 people have waited as long as 3 years to receive similar letters. Today, the hospital apologised to patients and their families.
18 months ago, we introduced a new software system here that allowed us to provide much more timely communication, but unfortunately it hasn't cleared this backlog that we've found.
The government has given Westmead 3 weeks to sort it out.
This is simply unacceptable. What happened at Westmead was a direct result of the former Labor government cutting back on staff.
But the opposition evaded all questions today about Labor's responsibility when it was in government.
Delays of that length are completely unacceptable, and we'll be watching what the Minister does in delivering a 3-week turnaround on all that outstanding correspondence.
The Director-General of Health is asking New South Wales hospitals to check all their records. Bridget Glanville, ABC News.